Hello, welcome to a third episode of the HLI podcast. Today, we're honored to have Yasha Mittal as our guest to share with us on legal and ethical issues surrounding PPE for health workers. Jacob and I, Susmita, have the pleasure of hosting this episode. Yasha, it is a pleasure to have you here. I believe it's been 2 years since we connected over LinkedIn. Late 2018, you were about to complete your LLM in global health law at Georgetown. I remember we had some interesting discussion about health worker issues. One of those being the recent decision at that time by the Indian government to dissolve the Indian Medical Council and replace it with a board of governors while they were considering the bill in Parliament.
Thanks, Susmita. Thanks so much for having me here. I think I've always been interested in looking at how human rights principles apply to public health issues. As a lawyer, I worked for 3 years with the Indian government on a bunch of initiatives in the fields of public health and environment protection. One key issue that I worked on was leprosy, and basically try to look at how discrimination against persons affected by leprosy could sort of be curbed. So for this purpose, I assisted the Indian government in drafting a model law to curb this discrimination. And then we also filed a public interest litigation in the Indian Supreme Court to repeal some of the provisions under existing, federal as well as state laws that directly discriminated against persons affected by leprosy. So that's why like public health and human rights and the intersection of the two has always been, of interest to me. And I think social protections and the rights of health workers are also sort of very important in this sort of framework, which is an issue that I feel is often ignored. And I think the COVID-19 pandemic has brought these issues to the fore now.
Exactly. You're so right. I think the stigma and discrimination in the health sector that patients face, like leprosy patients, it's such a huge issue. And also the flip side, also the stigma and discrimination that health workers face. I remember you did share, you're very interested in applying human rights principles to infectious diseases. And that's where I suggested let's explore, the rights implication from a health worker perspective on the availability of PPE or the access to hazard insurance for staff that may contract these infections, from their patients. And this year, some of your observation and insights have been put to the test. But before we even go there, how are you doing in these precarious times, especially given your current UN assignment in South Sudan? And I'm sure your audience would love to hear more about your work as a judicial affairs officer with the UN as well. And thank you for taking this time to do this podcast on a personal capacity.
Thank you so much once again for having me. It's really nice to be here. So I am essentially a public interest lawyer. I'm currently based in South Sudan with the UN Peacekeeping Mission. I basically work with national justice and security sector actors on a range of initiatives to promote rule of law and sustainable peace. In the wake of COVID-19 pandemic, I am also looking at how justice delivery and prison management sort of plays out in keeping with COVID-19 prevention measures. Professionally, COVID-19 has reduced our interaction with, our national counterparts and slowed the pace of our work. However, things are gradually changing now. On a more personal level, since my family is in India, COVID-19 has also made it difficult for me to travel and meet my family. Traveling and waiting at airports has in itself become very tedious lately, because like we have to wear masks throughout the flight and at the airport throughout. And while that is necessary and makes sense to prevent COVID, it also causes me trouble while breathing, and it can also cause irritation on my skin. So it's been an issue for me. But yeah, I mean, I think despite all of this, things are gradually changing now, and we are sort of getting used to, living in a post-COVID sort of reality.
So hi, everyone. I'm very excited to be on this episode today. This is one of the ones I was really looking forward to. Being a young a young aspiring lawyer currently in law school, I'm always interested to understand how lawyers who are doing unique and interesting work kind of got there. So I think it would be fascinating for our listeners to hear whether this is something you knew you wanted to do straight out of law school, whether it's something that you discovered along the way. So I'd be interested to hear a little bit about that.
Thanks for that question, Jacob. So while I was in law school, I kind of knew that I wanted to work on public interest issues. I think throughout law school, like the kind of courses I took and the kind of moot court competitions I participated in, I always sort of swayed towards human rights law or public interest law. And I think this is what led me to join a think tank right after I graduated, where I basically provided advisory services to the Indian government, as I mentioned earlier, on public health. And currently working with the UN, I'm working with the UN, and it is essentially a dream come true for me, because I get to work with and interact with a bunch of different passionate and driven, individuals who are keen to sort of, drive meaningful change. Before this, before my current assignment with the UN, I did short-term assignments with 2 advocacy organizations in the US. One was on sexual and reproductive health and rights, and the other one was on anti-tobacco policy. Both of these assignments were very interesting, and I was essentially looking at the South Asia region and the different countries in South Asia and how they are tackling these 2 issues. And I think I would just, now that I'm mentioning, my sort of journey to where I am today, I think it would be, incomplete without sort of mentioning the support and mentorship that I've received from, my professors at law school, as well as my senior colleagues in different fields, who have given me valuable advice on how to move forward. And you're one of them, Susmita. And I think since we connected on LinkedIn more than a year ago, I believe we have become friends. And I really look up to you for advice on all personal and professional matters. So I'm grateful that we've remained connected, and you're doing some interesting work. And I look up to you for everything that you're doing. And hopefully I'll follow in your footsteps maybe in a couple of years. So thanks.
Thank you so much, Yasha. That is very kind of you. I, in turn, have learned a lot from our discussions, and I always look forward to them. I'm very glad I've been able to pick your curiosity, towards health worker rights, because I think you have the right mindset and you bring in so much, of your legal background into it. So it's been, amazing. And, with that, we'll segue into the blog you wrote for HLI on PPE and infectious diseases. And, this was written before the pandemic. This was, I believe, in 2019 when we had it published. And of course, the PPE discussion has blown up since then. So I'd love you to share with us, some of, highlighting the rights. Do health workers have a right? How do you describe the importance of it? And now that, we had seen these in some earlier pandemics, but now given the current situation, what is your position? I'm thinking maybe it's stronger. Are there other dimensions that have come into it? I'd love to hear, from you about that.
Thanks, Susmita. Thanks for the question. I think the significance that PPE holds in healthcare service delivery has definitely gained a lot of traction in the backdrop of the COVID-19 pandemic. As we know, under the right to health, under the International Covenant on Economic, Social, and Political Rights, we have the access, availability, efficacy, and quality, these standards, the AAAQ standards that we use to sort of look at different issues within the health sector. And I think we know that the access, availability, and effective use of PPE has also been an issue, as observed in past pandemics like Ebola. However, I think it is only now that during the wake of the COVID-19 pandemic that this issue, the lack of access or the lack of sort of quality access to PPE has finally gained the attention of policymakers and multilateral organizations, because there are severe PPE shortages, especially in developing countries, including India, and they have resulted in the spread of disease and the deaths of health workers. So I think in that sort of, with that sort of background, I personally believe that health workers do have a right to access and avail of PPE, good quality PPE under international law, as well as under their domestic statutes, such as, the constitutions of every country. So just looking at first the international law aspect of it, I think the International Covenant on Civil and Political Rights contains the right to life, which is also embodied under the domestic constitutions of most countries across the globe. And I think the right to life sort of encompasses the right to life of a health worker, sort of encompasses the health worker's ability to access and avail of good quality PPE so that the health worker can protect himself or herself, his or her family, as well as the patient who he or she is treating. So I think that sort of right to health, right to life, sort of gets covered both internationally as well as domestically. Then, if we look at the International Covenant on Economic, Social, and Cultural Rights, we look at the different rights like the right to health and the right to have a good working environment. Those rights also are applicable to frontline as well as other workers working in the public health sector. And many times when domestic statutes don't provide adequate social protections, international legal standards or international human rights standards sort of provide the basis for providing these protections, through strategic litigation or through making submissions before policymakers that these rights are universally guaranteed across the globe, and so they should be guaranteed domestically as well. And I think the rights of health workers, when they get violated, they also impact the rights of patients as well as the general public, because if the health workers don't have access to PPE, they would not be able to contain the virus. And if they contract the virus, they will give it to their families, and those families will give it to other people. So the virus will keep spreading. Also, if the health workers contract the virus and they treat patients who's recovering from it and who perhaps can contract it again because of different reasons, because we are still sort of discovering COVID-19 and new strains of it and how it works, and whether a patient who's already been affected can get affected again or not. So there are all these different issues that play out, and I think having access to PPE sort of reduces the chances of all those different risks that can play out. I think the right of health workers also sort of corresponds to the duty of health workers, and I would personally equate duty and right in the same line in this particular context, because the health workers have a duty to themselves to remain healthy and free of disease, to have a healthy family, to be able to effectively care for their patients without having to worry constantly that they're going to contract the disease, their family is going to contract the disease, or that they won't be able to effectively perform their duty as a health worker. And I think, again, all of this reads into the right to have a safe working environment as well as the right to health of the health worker under the International Covenant on Economic, Social, and Cultural Rights.
Thank you. That's really interesting and important. I was interested in zooming out a little bit away from the patients and the health workers side of things and looking more at the government. So in your blog post for the HLI, you spoke about the PPE shortage during the Ebola outbreak in 2014. And given that during the COVID pandemic, so much of the public discourse has been around how governments have responded or should have responded to this issue of a shortage of PPE. So I was interested to know, given your knowledge of the shortage during the Ebola crisis, whether you thought governments were or should have been adequately prepared for this issue.
Thanks for the question. I think this is a very important issue, and I think governments all over the world have signed on to a bunch of different international documents which require them actually to be adequately prepared to ensure that their health workers have adequate social protections and have access to PPE. I think some of this social protections framework applicable to health workers, we can see it in the International Labour Organization's general recommendations. I think one of them, which was number 97, which deals with the protection of workers' health which is the Protection of Workers' Health Recommendation, as well as the ILO Convention, which is the Nursing Personnel Convention, number 149. All of them sort of lay a lot of emphasis on the duty of governments to ensure that health workers are provided with PPE to protect themselves and the patients they treat, as well as have, decent work environments, decent and safe work environments to function effectively. So governments that have signed on to, say, the ILO Charter, as well as the ILO conventions, have an obligation to sort of ensure that adequate measures are in place to protect their health workers. Also, I think the ILO conventions allude to training on PPE and how that is really important for health workers, so that they know exactly how to use the PPE to be able to protect themselves as well as people around them. And I think this has been a concern, especially while dealing with infectious diseases. We saw that play out, some health workers didn't know how to use PPE during the SARS, when the SARS crisis had happened. And I think a joint WHO and ILO policy guidelines discusses this in more detail. And I think our listeners can perhaps look at that if that's of interest. And I think if to be adequately prepared in the future, and despite all of this, all of these obligations that governments have, if they are still not prepared and they want to be more prepared in the future, I think grounding PPE requirements and social protections under domestic law and strengthening the social protection framework applicable to health workers, under law would be, I think, really useful, and will definitely impose strict obligations on healthcare delivery institutions to ensure that health workers are provided with PPE whenever there is a future pandemic.
Yeah, I think picking up on that, you're so right. The implications of PPE, it just gets beyond the fact of just getting infected. I mean, that is certainly the main concern, as you related it. It's not only just getting infected for the health worker and the implications of that, but also for patient safety, like what happens to the next patient he's, treating, and also to, their family members. During this, pandemic, the hardest thing has been hearing to health workers talk about the issues they're facing from it. A lot of health workers, from what I've heard and even read in different comments, talked to different people, was where when they went home, they actually would stay in the basement, or they would stay in a separate room. They would not be able to talk to their kids. Many of them, in fact, rented hotel rooms to stay in and actually not see their family for all this time while they were treating patients. The mental health effect of that, isolating from your own family members, your friends, I think is enormous. And many times, especially at the start of it during March, I remember reading where there was a lack of PPE, like you suggested, the coordination, the response was not as it should have been, or it's not what we thought we'd even see. And they were required to reuse PPE. They were required to put them in paper bags, keep it away. Many a times when they were trying to share it with social media, I think there were repercussions from employers because they didn't want them to speak up about it. The guidelines that came out from many organizations were not very clear, or they were not mandatory. So businesses were able to get away with it. There was certainly some things that came out during the pandemic that was very interesting. In the US and certain states, we did see where the whistleblower protections were expanded. They were expanding to allowing health workers to really share this information with the social media, not just to their employer when there was a cause for concern. But at the same time, like you said, there is more to be done, and more has to be looked at. But I think what we cannot discount, that this kind of even goes beyond the health sector. It applies to all essential workers, everybody that's working on the front line, like whether it's in a grocery store, and it's even in the hospital, in a health system. It's not just the health workers that's seeing the patient, it's right down to the administrator who's taking in the patient, the person who's cleaning the facilities. I think being, aware of those. The other thing that really came up for focus, and to me, I think was very personal, was migrant health workers. I myself am a migrant health worker. I studied in Nigeria, I came to the US, and that is what gave it. And we had stories about where migrant health workers who were still on a visa, they were worried that if something happened to them, what happens to their families? There were people that were actually having to write out their wills if something happened to them. They were trying to plan, if they died, their family had to leave the country, how they organize for that. And on top of that, health workers, just like the regular populace, have had to deal with day-to-day things, whether it's taking care of the children, putting them in childcare. And on top of them having stigma and discrimination, there were issues about where people feel health workers infected and they were getting treated very poorly. Last June, I kind of put out a blog on some of the, some of these things and the key recommendations. One of the things that I'm very happy about, as the vaccines have become available, we are seeing that they're being given to health workers first, which I think is very necessary to kind of stop them from getting infected, stop them from spreading it. And as you were aware, and you mentioned that, this is not the first time we're seeing many of these things in a pandemic setting. This has been on a larger scale. In your view, are you anticipating future pandemics? And what are your recommendations on maintaining adequate PPE stockpiles for the future?
I think with the changing climate conditions and the growing population, across the globe, I think it is safe to assume that there will be pandemics like COVID-19 in the future, just like there have been pandemics in the past. And I think adequate PPE stockpiles can be maintained, like I mentioned earlier, if they're mandated under law. And if there is a social protection framework applicable to health workers, and they mandate that hospitals and healthcare service providers provide PPE to health workers, and there are penalties for violations such as financial penalties or stripping of licenses, then there can be some deterrence and some compliance as a result, which can ensure that there is adequate access to good quality PPE for all the health workers. And like I said earlier, like internationally also, we have, the international covenants, the ILO conventions, which provide adequate basis for imposing duties on governments at the policy level to take necessary measures to, implement laws like this, like I just mentioned, which can ensure that PPE is available, in fact. Again, compliance of all of this, at least at the international level, can only be ensured through, all these human rights, the different human rights mechanisms that we have under the different treaties, which sort of ensure accountability and transparency, globally, and ensure that governments sort of comply with their obligations under international treaties.
Thank you so much, Yasha, for that comprehensive look, at PPE and what it means to the health worker and just for the whole system, our whole health system. I think some of the things that you highlighted, like just to go over them again, one is how it really relates to patient safety and public safety at large, and why this needs to be included into our health financing, into thinking of how to strengthen the system. And I really believe that health workers need to be part of that strengthening system, to be able to draw on all these reflections, to draw on all those lessons from what we had, or else we just keep repeating the same mistakes. And you're right, there are international treaties and covenants which are ratified by multiple countries, whether it's the ICCRP or the ICESCR, and what you alluded to, the General Comment 14 on right to health. These are frameworks that are already in place and can be utilized to provide the social protection frameworks nationally. Thank you so much for sharing with us all your insights. Thank you, Jacob. Thank you, Yasha. And before we sign off, did you either of you want to say a few last words.
Thank you so much, Susmita. Thank you for having me again. I think, as my last comment would essentially just be that I think COVID-19 has highlighted a lot of existing issues in the health sector across the world. And I think now, governments and policymakers really have an opportunity to plug the gaps that have been highlighted and to ensure that when there is a future pandemic, we are adequately prepared to deal with it and address it. So that would be my sort of response. Thank you.
Thank you. I just want to say thank you to Yasha and thank you to Susmita. This was a really interesting episode. I really was looking forward to this. This was such a big issue throughout the pandemic, and it still is an issue. And I think that more people need to know about this and care about this. So this was a great episode, and thank you so much.
Wonderful. Please join us next month, second Thursday, March 11th, to explore another facet of health workers in COVID. We welcome your suggestions and comments on our social media pages or email us directly at podcast@healthlawinstitute.org.